Our fifth speaker is code 5048, answering the question, how should the World Health Organization prepare for the next global pandemic?
During the COVID-19 pandemic, many celebrities had unique responses and cures. A Swami in my home country of India bathed himself in cow urine. Podcaster Joe Rogan used horse medicine, and American rapper Drake, partying unmasked in Miami, trusted God's plan to get him through the pandemic. But quite frankly, it seems like the leading health organization internationally, the World Health Organization, might be modeling Drake's response, especially considering that their response to COVID-19 was lackluster at best. That's why an article by the Center for Epidemic Prevention Innovations explains on January 17th of 2024 that currently, because of the COVID-19 pandemic, SARS-CoV-2, and rising global temperatures, the odds of the next global pandemic in the next year have skyrocketed to 1 in 50. And considering that over 7 million people died during the COVID-19 pandemic, more than double the population of this state, it's imperative we ask today's question. How should the World Health Organization prepare for the next global pandemic? And the answer is simple: preemptive investments in, first, the front lines of healthcare, second, medical infrastructure, and third and finally, global surveillance. Now, American entrepreneur Bill Gates has done incredible things. He founded Microsoft. He makes VR headsets. He even started a polio vaccination fund. But his next business endeavor is guaranteed to be impossible, turning Des Moines, Iowa into a fun vacation spot. But Bill Gates has been doing something the WHO isn't: funding medical professionals. And that's the first key way that the WHO can prepare for the next pandemic, by investing in their medical systems and the front lines. An article by the Global Opportunity Forum explains on April 7th of 2023 that there is a large shortage of medical workers, and that's going to be exacerbated by 2030. Worldwide, over 10 million medical workers are now needed to ensure that our medical systems run properly. But the problem is, the WHO is doing little to nothing to ensure that during the next pandemic, we have enough medical workers to stop it. And that's crucial. A final article by KFF explains on June 13th of 2024 that if the WHO decides to invest in medical professionals, the main way would be scholarships. 90% of medical professionals here in the United States say that cost is the #1 barrier of entry into the medical profession. And the WHO can change that. They've received $816 million of new funding from the United States and are proposing $2.6 billion of funding from the G7. They have the money. Now they need healthcare workers. Now, considering that during the COVID-19 pandemic, many African nations didn't have adequate access to vaccines, it was, at some points, literally their last shot to fight the pandemic. And in the case of the WHO, they need to recognize that for a future pandemic, because the second key way they can prepare is improving medical infrastructure, especially for vaccinations. UC Berkeley explains on January 17th of 2023 that in countries like Ghana, over 33% of vaccines were rendered useless because there wasn't cold chain infrastructure. Basically, vaccines need to be stored at a certain temperature every single step of the way until they reach a patient. And when they don't, they're useless. That's why across Africa, over 1/3 of doses were thrown away because there was no medical refrigerators or simple infrastructure to keep these vaccines safe. But how can the WHO change that? What infrastructure do they need to provide? Well, electricity access is sometimes scarce in rural Africa, but there are other ways to create refrigerators and cold chain infrastructure. Look no further than entrepreneurs in Sierra Leone. As UNICEF finds on January 24th of 2024, UNICEF and Sierra Leone partnered to vaccinate over 7,000 children using solar-powered refrigerators. And that was especially heartening for 27-year-old Abiri, whose 2-year-old toddler was at risk of infant mortality, as many are in Sierra Leone. Because of access to vaccinations and this cold chain infrastructure, her family is now safe. For that key reason, it's safe to say that the World Health Organization can improve their response if they invest in infrastructure. Now, in his hit song, Search and Rescue, Drake says he can see everything, but the WHO can't, especially when it comes to a global pandemic. And that's the third and final way they can improve their response in the future, by enabling global surveillance. The BBC explains on May 13th of 2023 that a lack of access to surveillance meant a lack of action. Because the WHO was not prescribed to receive surveillance in countries that didn't approve it, their response to the COVID-19 pandemic started on January 30th instead of January 22nd. That, as the BBC said, could have caused thousands of preventable deaths from not happening in the first place. The issue is clear. The WHO not only has lack of access, but a lack of technology in key areas to stop pandemics. And as we saw in COVID-19, that could have saved lives. Now, some of these technologies are more obscure. The CDC finds on June 14th of 2024 that one of these technologies is wastewater surveillance. In cases of polio in New York City, when over 11,000 patients were suspected of having polio, wastewater infrastructure and surveillance cut that down to 89 people. It's scarily effective. And if that isn't enough, the Council on Foreign Relations finds that syndromic surveillance, where everyone detects fevers across the countries that are involved in pandemics, might also stop pandemics before they start. For that reason, it's safe to say that the WHO needs to improve surveillance, whether that be through wastewater or syndromic methods. So, as we take a step back and look at today's question, how should the WHO prepare for the next global pandemic? It's safe to say that they need to preemptively invest. First, in the front line of medical workers. Second, cold chain medical infrastructure. And third and finally, global surveillance. And a lot like Drake, it seems that seeing the current response to the COVID-19 pandemic, the WHO might need to start from the bottom. Thank you.